Welcome back to Indianapolis This Week. The proposal to reform healthcare in Indiana and expand it to thousands of people is now open for public input. The governor's plan is called HIP 2.0, or the Healthy Indiana Plan 2.0. But before we get to that big issue, there's a health scare across the nation that has reached central Indiana. Children becoming sick with the enterovirus 68, which causes severe respiratory issues. More than 1,000 children in the United States have become sick with that virus, and now we're seeing our first cases right here in central Indiana at Riley Hospital for Children. Now, starting tomorrow on Monday, visitor restrictions will be in place at the hospital to protect their patients and to try to prevent the spread of that virus. No visitors younger than 18 or visitors who are sick will be able to visit the neonatal intensive care unit, and those restrictions will also be in place at multiple IU Health facilities. Joining us now are Dan Evans, the president of IU Health, and Bryan Mills, the president of Community Health as well. Gentlemen, that's the big issue of the morning, of course, on this Sunday morning. What are your hospitals doing respectfully to make sure that people are safe during this potential health scare?
Well, as you mentioned, Raphael, tomorrow at IU Health, Monday, there'll be restrictions on visitation in Riley Hospital. This is routine. Whenever the threat level's a little higher, we take precautions like this in order to protect our patients.
At Community?
We're monitoring the situation. We have not limited restrictions at this point. Obviously, we are concerned about the safety of our patients, visitors as well. We do not presently have any cases within our system, and we advise family members that are concerned to consult their pediatrician and family physician if they have concerns right now.
The big issue this morning as well is the Healthy Indiana Plan 2.0. Public comment now underway. You and the other hospitals in the area support it. Why is this such a key plan, the HIP 2.0 program?
I think what people need to understand is that this is for the working Hoosiers. These are the working Hoosiers who don't have enough to afford health care. You know, people obtain health care through the public exchanges, through subsidies from the federal government, and this is the donut hole that was left out. So we have a lot of people who are working Hoosiers who don't have health insurance, and until you talk to people who don't have health insurance, you don't understand the ramifications of that. And so this is a way to provide a plan. We've worked in partnership with the governor's office, with the state, and with one another to put forth a plan that we think will help all Hoosiers.
And is this the best plan available, or is this the best plan that we can get right now?
This is the best plan for Hoosiers. We're indebted, Bryan and I and the other hospital CEOs, to the governor for his flexibility in this regard. Right now, Indiana is the only state in our region that's not expanded Medicaid. So therefore, Indiana has the highest percentage in this region of uninsured. So I echo what Bryan said. It's mandatory that we expand HIP.
The hospitals will be working with the state. Can you give us an idea how that partnership will work in an effort to make this work? Because this cannot just work on its own.
Well, the funding mechanism is a shared mechanism where the hospitals are participating and the state is participating. The actual plan itself was a collaboration between the FSSA, the state budget agency, the hospitals, the health association leadership, and the governor himself is the ultimate leader of the effort. So it's a team project for all of us.
What boggled my mind, I saw a figure that if nothing were done, you are currently losing $3 billion collectively on health care. That just boggled my mind.
Oh, Raphael, I don't know the total number. I only know our numbers. I know in the most recent fiscal year, our total write-offs for charity were in excess of $250 million.
Can you sustain that? And because I think that's the big, people need to understand that. They think, oh, the hospital's big, they can just write that off. But it does have an impact on jobs, on services.
Well, A, we can't sustain it, and B, it's not providing the best care to our patients. I mean, if the primary source of care is through an emergency room, that's not the type of care that people need to maintain their health, to understand what their chronic illnesses are, and to receive care for that. And we can do that through an insurance product.
And we have seen the numbers in our state. We do have a population that is somewhat unhealthy, with diabetes, obesity. Do you think this plan will help address some of those numbers that in many regards drive up the cost of health care because folks may choose not to or don't have access to health care?
Well, I'll give you a statistic. Well over half the patients at Riley Hospital are Medicaid or poorer. So to answer your question specifically, the only way to improve the health status of the state is to deal with people who are poor, and have no insurance. And this plan will do that, and that should move Indiana's numbers because we're definitely at the bottom of the heap in our health status.
Because this also is an economic issue, right? President Mills, I mean, this is an issue that not only do you want healthier people, but if they're healthier, they will go to work, they'll have jobs, they won't be home. I mean, this is an economic...
Absolutely. And will it work? I mean, we at least have a plan. We at least have a plan to identify somebody's illnesses and to get them assigned to a care team that's going to work with them on a plan for wellness and accountability and action and follow through and make sure that people are getting prescriptions. And with that, healthier people are going to be more likely to not only have a job, but retain that job. So I do believe it's an economic issue in addition to this is an interest for every one of our citizens.
And last question, we are in the public input period. What do you want the public to do now to engage the system? I mean, what do people need to do to sort of say, I like it, I don't like it? What should they be doing right now?
The public comment period is closed. So the waiver application to CMS, to the federal government, has been submitted. We'll hear back from the federal government on September 21st.
And you're hoping, I would imagine, that they will say, it's a green?
Let's move ahead.
The other choice is not a good other choice, right?
The other choice is for the federal government to say no, and I don't think they will. We're optimistic.
Good. Well, we hope that all will go well. We hope that you'll come back and join us here in the program. President Evans, President Mills, thank you so much for joining us this morning in Indianapolis This Week.